A common question that my front desk staff gets asked upon initial evaluations is, does acupuncture last and how many sessions are needed? I want to answer this in four different ways. The way acupuncture works happens on the nervous system, and for that, starting from that point, there's a lot of hormones that get secreted, nerve innervation that gets stimulated, blood flow that gets stimulated, and for those purposes, those incidences that occur as a result of the treatment do have a shelf life, meaning that they do occur for about 2 to 3 days after the treatment, and sometimes 3 to 5 days even. But after that 3 to 5 day period, they start to wane back to normal. So if we're working with inflammation and we want to stimulate prostaglandin through acupuncture, prostaglandin will be secreted for 3 to 5 days in a much greater circulating amount in your bloodstream than what it usually would be. And then after 5 days, it starts to come back down to normal. If you didn't hop on that bandwagon and hit that snowball effect every 5 days for a couple of weeks, you'd miss the overall growth of that treatment and growth and progression of the stimulation, and that would lead to a much longer treatment protocol. So there is a shelf life of the peptides, so that does require almost every treatment multiple sessions, but some only take a few. The second thing is, generally by session 2 or 3, we've been able to figure out enough about the different things that we can affect with acupuncture and on the other systems that we're using, that the amount of treatments we can then dictate would then be able to be a little bit easier to come up with at that point. But it would take the first 2 or 3 sessions. If it's a muscular condition or pain, very often by the third session, you may be 80 or 90%, at which point I may not need to see you for weeks or months at that point. Third, multiple sessions snowball, like I was mentioning before. So not only does multiple sessions give you more information about how long it'll take for a long permanent change, but it also gives a stronger treatment overall. And lastly, the question that does affect how many sessions are needed is, of course, what are you looking for from the treatment? If you're looking just for functionality, like my pain patients who may have sciatica and it's so bad they could barely drive or go to work and they're not performing their activities of daily living, then they're just looking to be functional and get back to work. That could take a very short period of time, maybe just 2 or 3 sessions. But if you're talking about an athlete who comes in who runs triathlons, for example, or a CrossFitter that I treat, or multiple of them, they may want more functional strength and functional movement without any pain. And so they may come in every couple months for a long period of time just to kind of take care of any little minor injuries or aches and pains that don't turn into something worse. So in those cases, the amount of sessions would drastically differ, but it's because the goals of the patient are drastically different. But by session 2 or 3, you should have a pretty good understanding or idea where the treatment protocol needs to go. And being upfront about that, I find, is the most important thing.